Okay, hi, it's Dr. Buford. We're just getting started on the left knee. We're looking in the inside or the medial compartment right now. This structure just underneath that shaver that you see is the meniscus. So as we look up here, this is the anterior horn of the meniscus. The body is in here, and then the posterior horn is back here. You've gotten a little bit of wear and tear changes on the tibial plateau, but not bad. And as we look up at the femoral condyle up above, this looks pretty smooth up here. So all in all, I'm happy with this medial compartment. As we slide over here and look in the notch, that's your anterior cruciate ligament. We'll see a nice pretty blood vessel there. Just make a little bit of room so we can see. And so now here's your ACL. That looks good. We're going to sneak over here into the lateral compartment in just a minute. Okay, so now we're getting a really good shot of the lateral meniscus. This is the area that had a tear in it on the MRI scan, and now that we're getting our eyes on it, we can actually see it's a little bit more complicated than that because you really have basically a discoid meniscus, meaning that the meniscus is almost entirely covering the plateau. See, the plateau's underneath here, but this meniscus is almost like it's almost completely covering it like a blanket. And so the reason why that's important is because discoid menisci tend to tear, and sure enough, you've got a tear. This tear right here is not repairable, so we're going to take a straight basket forceps and trim this back and make it look a little bit more normal so it doesn't bother you anymore. But in terms of meniscal repair, that'll actually mean you recover quicker, almost certainly. So I'm going to take out the probe. This is something that your PRP injection will likely help also. Okay, here's our pair of scissors. Basically, I'm going to turn on a little bit of suction. Yeah. And so now we're going to use this. If you have like a curve to the left or right, just be looking for some options. You can see the tear goes back to right about there. Okay, and so that really takes care of the posterior part. I'm going to put in, do you have one that curve to the right or straight 90-degree right? That'll work. Yeah, this will work, the 90. So we're going to put in a different kind of cutter now. These are all just basically scissors. We'll show you some more in just a minute. Sorry. Scalpel. Okay, so now we're using this more specialized pair of scissors because it cuts kind of at a 90-degree angle to trim right in this portion of the tear. And so it's starting to look it's actually starting to look more like a normal meniscus. And there's still a little bit of a tear right in the middle there that you can see. Yeah. So we'll put in our shaver here and we'll start smoothing out this. So the real area that I still want to work on a little bit is right in here. We'll go off on the video, show some more in a little bit. Okay, so we've got this meniscus trimmed back to as stable a margin as I think we can get. You've got this tear back here. We probed it, and that tear goes through the body of the meniscus. So I'm going to put a stitch right here and anchor that down. You can see the popliteus right there, so we can't really put a stitch back here, but we certainly can right here, just to try and put in a vertical mattress just to hold that together. Now, potentially, we may want to put a satiric stitch here, but we'll decide on that in a minute. Okay, so this little skid that you see is a guide for our implant. We're going to be placing an anchor down across that tear right there. And then if that does its job, then we will not have to probably do anything over here. Okay. Okay, so you can see our one suture going across the tear right there. I like the way that looks. Now we've got to decide what we're going to do with the rest of this here. We'll show you some more in just a minute. Okay, just to tell you what's going on here, we've actually moved the scope to the medial portal. That's why the view's a little bit different. We've basically tried to refashion this meniscus. It's well attached in the body and anterior horn. You can see the meniscocapsular junction here. You can also kind of see where the blood supply kind of ends. It really runs out right into about this region here, but there's nothing on the inner edge. We've got two sutures placed across the tear back here. See those? And that looks like it's holding that meniscus. Otherwise, we would have had to remove all of that, and I really didn't want to do that. And so now the next thing to do, our next little trick, is to go ahead and inject our PRP, and we'll go ahead and show you how we do that in a minute. Okay, so you can see our needle coming in. We're going to just get it into the meniscocapsular junction a bit there. Hold the camera now, just hold real still right there. And now we're going to start to inject our PRP. We're going to place it in a couple different areas. But this is one. If you keep watching there, you'll see things start to fluff up there. You see there's the PRP coming out. Okay. We obviously don't want to affect our suturing. And the rest of it, we're going to take out the water. Okay. I'm just going to slowly take the water out here. Okay, you can see we've turned off the water. This is kind of dry now. And now the rest of the PRP is going to go right into this space right here. That's actually it right there. Okay? So good luck to you now. I really hope this does the trick. Bye-bye.